Hello, this is Maria and Esther, and we are doing our research project on cold sores. First of all, what are cold sores? Cold sores are small, blister-like lesions located on the face. They are also known as fever blisters. These blisters form on the face and then break off in ooze. Scabs are then formed from the ooze, but the scabs do come off. These cold sores may cause pain, burning sensations, or itching before bursting and scabbing. What causes cold sores? Cold sores are caused by the herpes simplex viruses. There are two types. Herpes simplex virus 2, aka HSV1, is the most common virus that causes cold sores around the mouth. The second type of virus is called herpes simplex virus type 2, which is HSV2, and that virus is much less common. HSV2 results from specifically having oral sex with a person who has genital herpes. Where do cold sores occur? Cold sores occur on the face or inside the mouth. Some of the most common places that cold sores have appeared include the lips, chin, cheeks, inner nostrils, gums, and roof of the mouth. When do cold sores occur? The HSV virus can be activated during periods of mental stress, deep sadness or upset, injury to an affected area, menstruation, or intense sunlight. What are the symptoms of cold sores? The symptoms of having cold sores include mouth or tongue lesions, blister in the mouth ulcers, mouth or tongue pain, lip swelling, difficulty swallowing, sore throat, swollen glands, elevated body temperature, dehydration, nausea, headaches, and recurring outbreak infections. How do cold sores manifest? The HSV virus enters the body through genital or oral fluid. They then replicate in the stratified squamous epithelium, which is the moist lining found in the mouth or esophagus. And they are taken up by the unmyelinated sensory nerve fibers, which are nerve fibers without a protected myelin sheath, which covers the axons for electrical insulation. The virus then travels to the dorsal root ganglia, which is near the spinal cord, and remains dormant in the nerve cells. When the virus becomes activated, the virus travels back to the stratified squamous epithelium of the skin or mucus and gets secreted out. Next, Esther will be discussing about the mode of transmission, incubation period, and treatments for cold sores.
Thanks, Maria. So now we will be moving on to discussing the mode of transmission. Cold sores are transmitted through various ways, including kissing an infected person, sharing eating utensils, cups, towels, razors, and the like, having sex, touching the infected person's skin. It can also be transmitted during childbirth. The incubation period is 2 to 12 days. The person who is infected will be contagious to others anywhere from 7 to 12 days until the blisters are completely crusted. This is the period of communicability. There is currently no cure for the viral disease. Sometimes the sores can heal without treatment. It's also very important for those with the herpes simplex virus to protect themselves from sun exposure, as it can trigger the disease from recurring. There are different antiviral medications available for use in oral, intravenous, and cream and ointment form. Some of the prescription antiviral medications include acyclovir with a usual dose of 200 milligrams 5 times a day for 5 days, famciclovir, a single dose of 3 times 500 milligrams, valacyclovir, 1 gram 3 times daily for 7 days, and also the topical acyclovir or peniciclovir. If you or a loved one is struggling with the herpes simplex virus, please seek medical attention right away. Thank you.